All right, let's do another epilepsy case. These cases are all fictional. If there's any resemblance to you or anyone you know, it's because these cases tend to be common and otherwise purely coincidental. All right, so let's say we have this lady, she's 26. She has a diagnosis of generalized epilepsy that started when she was 12, around the time of her period. She was started on an anti-seizure medication that has otherwise been effective. She hasn't had a seizure in the last 5 years. Her seizures were small twitches. She would have jerks, and at nighttime, she would have big seizures. She was later diagnosed with juvenile myoclonic epilepsy. The jerks and the twitches were myoclonic seizures, and the big nighttime seizures were generalized tonic-clonic seizures. Because she's now 26, she is coming in to see if she can lower her seizure medication, one, and two, to see if she even needs seizure medication. Her MRI looks normal, and her EEG shows myoclonic discharges such as this. These are fast spike wave discharges that you see with juvenile myoclonic epilepsy. So here's the thing with this case, right? I mean, she hasn't had a seizure in 5 years, so I think that's a fair question to ask if she can lower her meds or even get off. But one thing I didn't mention in her history is she's recently gotten married and they're hoping to have a baby. And one of the things with generalized epilepsy is sometimes it can get better during pregnancy, sometimes it can get worse. Pregnancy is a very interesting time for epilepsy. In general, seizures are better during pregnancy, but they tend to be worse after when you're sleep deprived and your hormone levels are all over the place. So it can be a tough situation. In this type of patient who is trying to conceive and is otherwise young and wants to maintain independence, like driving, for instance, I would be a little hesitant to lower medications around this pivotal time of her life. The other thing is generalized epilepsies like JME and other generalized epilepsies that are diagnosed very young. They don't often go away. There might be a period where someone is doing better, but there's always going to be a potential of them having a seizure. So, certainly, even though you can lower medication at some point, I just don't think around the time of pregnancy is the time to do that. But overall, cases like this are very common that we see. If you're in this type of situation, definitely consult with an epileptologist who should be working with your OB.